Good morning, Kalispell. Hope everyone is doing great. Today we are going to talk about vertigo or dizziness. So, I did a little drawing here. I'm not sure how well this is actually going to show up. Maybe if I kill the lights here. And of course it's going to be inverted for you guys. But here we'll get the gist on this thing. So, there's several things the brain can adapt to. It can even adapt to deafness and blindness. It cannot adapt to dizziness. So today, this video, we're going to explore the more common causes and solutions to dizziness. Dizziness is a very common clinical complaint. It's also very disabling. We've had many patients where it controls their lives. They don't ride in a car, they don't drive anywhere, they don't get on airplanes, they don't get on boats, they don't go to the fair or amusement parks because of it. So in this drawing, you can see right kind of dead center. The center for dizziness in the body is the vestibular nucleus. It's not in the brain, it's in the brain stem, and it's in the low brain stem. And it's just above the atlas vertebrae, which is right here, right by the ear. I'll grab a spine. Just for reference on the spine here, here's the atlas or C1 vertebrae. Vestibular nucleus sits kind of right in here but below the brain. So what this thing does, it doesn't self-generate the electrical impulses that tells your brain that you're dizzy. It's there to basically pass signals through, and it tells the brain that you're going to be dizzy. So 4 things that generate vertigo. The first one, I'm just going to start kind of up over here, is the inner ear. It's the first area, definitely the first area that we check when someone comes in that says they're dizzy. Things you have to rule out: infections, so if there's like fluid in your mastoid air cells, if you've had a head injury or a CT, that needs to be looked at. Acoustic neuromas, so something you'd see on an MRI. And that's a medical doctor. They're going to check this stuff off right away too. But the next thing is benign paroxysmal positional vertigo. And this means, so you only get dizzy if like you tip your head up and to the right or back and to the left, things like that. Your head's in a certain position. And this tends to be a super intense bout of vertigo, lasts 20 to 30 seconds, and then you feel off for the rest of the day. I've had it before. It's wicked, awful stuff. A lot of times people will fall down to the floor, but the good news is this is like one of the easiest treated vertigo situations that there are. So benign just means that it's not life-threatening. Paroxysmal means that it's short in duration. It's not like a lifelong type thing. And like I said, 20 to 30 seconds is generally what it lasts, and then you feel off the rest of the day. Position, you're just in a funny position, and vertigo because, well, it's vertigo. Another common name for this is canalithiasis. Good news is it's a pretty easy fix. It's like 1 to 3 visits, boom, done, if it's the inner ear. Pretty straightforward type stuff. The second source of vertigo, so back to my awesome possum drawing, is cerebellum, if you can read backwards. So it communicates extensively with that vestibular nucleus. It itself collects mechanical information from the way we live, exist, and function in our environment, which has gravity in it. And if we have a mechanical problem, that synapses going up to the cerebellum that goes to the vestibular nucleus, there's your spinal input, what we are the pros at fixing. It's like chiropractic 101. We're trained to look for mechanical problems and treat them, get them better. Number 3 on our list here, I wrote TMJ or TMD. It's the jaw joint. So when you have a TMJ misfunction or dysfunction, misalignment, neurologically it synapses with that vestibular nucleus. And consequently, when someone comes in that's dizzy, we look at the inner ear, we look at the cerebellum, we look at the mechanical input from the spine. Next on the list is the TMJ. Pretty straightforward stuff right there. Super common, like people, if they've been out snowmobiling or motorcycling or even skiing, biking, hit their jaw, knock their jaw off, they're dizzy. Happens multiple times a year. Last on the list of the major things is this C1 through 3. So back to the spine here. Right up here is our C1, C2, and then C3 right under it. The C just means that it's a cervical. The nerves from this area go right into the vestibular nucleus and can generate vertigo. Pretty straightforward stuff right there. Again, chiropractic all day, every day. In any case, what Dr. Gillen and I have been trained and taught to do is you examine the patient for the source of the bad neural pathway or the bad nerves that are causing it, and then you get on with your life and start fixing it. Part of the diagnostic involved with vertigo is the eyes. So the vestibular nucleus, if we come back here and we check, I have eyes right up at the top here, is that it communicates extensively with your cranial nerves 3, 4, and 6. So, an example, if you have a kid, I don't advise this, but it's just an example here, is put them in a chair and you can spin them around. They'll laugh. They think it's fun as heck. And then you stop the chair and their eyes, whatever direction they're going, will go thump, thump, thump and twitch that way. That's called a nystagmus. That's showing you, yes, you've stimulated the labyrinthine cells of the inner ear. It's communicated with the vestibular nucleus and it's generated a nystagmus. Whole lot of big words there. Sorry about that. But that's part of the diagnostic, is seeing what the eyes can and cannot do, and it will tell you extensively what the source of the problem is. Next, one of our favorites. So, again, back to my awesome drawing. I should have just drew this backwards. So it says muscle tone at the bottom. So, like, take your arm out, flex your arm, muscle tone. You can increase that tone voluntarily. The vestibular nucleus does not do voluntary tone control, so it's an involuntary mechanism. A lot of times, as a chiropractor, as a good chiropractor and a competent one, what we'll do is we'll go down and we'll check your feet and see if you have an unequal leg length, telling us, hey, we got a synapse going on here with the vestibular nucleus because we have uneven muscle tone. A lot of times, Dr. Gillen likes this one more, but she'll check your wrist length, so she'll have you bring your arms up over your head and she'll look into it that way. Really great thing about it, all of these things are chiropractic, like to a T, and now you know some more about vertigo. If you guys have any questions, comments, or concerns, feel free to shoot them over our way in a message and we'll get back to you. Have a great day, Kalispell.